Hi everybody, this is Russ with HealthForward Online, and I'm down here in San Rafael, California with Dr. Nancy Gardner, and I'll introduce you to her in just a second, but we're going to talk today about breast health and thermography and give you more information about why that's important to you. Okay, so here's Nancy, and if you could just briefly give us a little bit about your background and how you got involved in this.
Sure. My name's Nancy Gardner-Heaven, and I teach at San Francisco State in the holistic program. I teach about preventing disease. So anything that has to do with what people can do to prevent something. So what I'm going to teach you about today or share with you is how to lower the risk factors for breast cancer. And then also I've been doing thermography for about 20 years. Thermography is a safe way of looking at the breast without any radiation. And I'm going to show you exactly what it is that it sees. So it's a little different than a mammogram. We're not looking for a lump, but it's a useful tool. And I'm here in San Rafael. I have an Optimum Health Clinic here in San Rafael, but I also offer mobile thermography screenings in numerous locations all over the Bay. And I do that through Thermotech, my diagnostic thermology lab. So the class I'm teaching you is about Thermotech's educational series. So this is my PowerPoint presentation for the clinical application of medical thermology. I put this together to help educate doctors so they can integrate thermography into their screening tools so women don't just have to do mammograms and get radiated. Thermography sees early signs of breast cancer years before a tumor can be detected with a mammogram. So we're seeing the signs of the veins setting up to feed a tumor much earlier. There's no painful compression, no harmful radiation. We're looking at your body's heat. And mammograms have a 40% false negative, sending you away thinking there's nothing wrong, and an 80% false positive. Now this is for women who have postmenopausal and soft breasts. For young women with dense breasts, it has a 60% error rate. So those young women with predisposition, family history, they're trying to avoid radiation, not such a good tool. So, and then thermography has a 9% error rate, and that's for both false positive and false negative. So it's an excellent tool in that way. In his book, Preventing Breast Cancer, Dr. John Goffman, who's a Ph.D. in radiology and a board-certified radiologist, and he worked at UC Berkeley, did a huge study, and said that 3/4 of the incident of breast cancer is being caused by earlier ionizing radiation, primarily from medical sources. However, the TSA people are out there getting you too, so don't stand in front of that full body x-ray and the TSA, because it does cause cancer.
Okay.
So let's go through. This is just the little things I teach the doctors, and that is mammograms are looking for a lump. So they kind of say, oh, you have a lump in the 3 o'clock position in your right breast or in the 9 o'clock position in your left breast. But thermography is looking at vascular features. So we look at quadrants of the breast. So cranial medial, caudal lateral, cranial lateral. So you'll hear that in your report of different quadrants that your features would be in. Okay. So I always like to dispel the mystery about breast cancer. You know, sometimes people just think it's this horrible thing that comes and sneaks up in the middle of the night and gets you. But it's not. Most of it is years in the making, and it's years of compromised immune system, stress factors that cause it. So let's take a look here. There are 2 factors in the development of breast cancer. One is atypical cells dividing with dysfunctional DNA. And the second is a blood supply feeding the tumor formation called neoangiogenesis. That's a new blood supply that develops around feeding a tumor. And that behaves a little different than normal blood supply. So I'm going to tell you how you can tell the difference between that and a normal blood supply when we're looking at thermography. Okay. So here's a cutaway version of the duct. And so it should be clean inside, but when you go to deep states of sleep is when you clean out dead blood cells and dead cells that are sloughing off, and when you're under stress and not sleeping well and you have not enough antioxidants, what happens is abnormal cells start to reproduce with dysfunctional DNA, and it fills up the duct, and when it gets full like this, you can actually palpate a lump. And this is where the doctors like to go in and biopsy it. The problem with that is they take the risk of spreading it outside the duct and giving it a blood supply. Now, if we get this early enough, we can turn it around. And how do you do that? Get the patient to sleep better, get them on high antioxidants, get them off of sugar. Elevated blood sugar increases abnormal cell growth. So we want to get them off, and it also causes infections. So we want to get them off of that. Now, when you look back at this, see how this is a nice, clean little a little lump, and it's encapsulated. But what happens is, if it goes outside the ducts, this is when we want to take it out. And a lot of women don't know how important it is to get these lumps early, and they're so afraid of biopsying that it's going to spread that they don't go in and get this out. If you get it out before it goes into the lymph nodes, you don't have to do chemotherapy. Chemo is totally contraindicated for breast cancer, only if it's gone into the lymph node and another organ. So we want to get in there and get that little puppy out. And then with the same thing I would do with someone with an early sign is build up their immune system, get them sleeping better, and help them to get their own body to clean that out.
Okay.
So these are the different ratings we have on a scale from 1 to 5. 1 and 2 are benign. 3 is atypical, and what atypical means is just not the way it should be. It's suspicious, but it's not a pathology or a disease yet. So it has a very low risk factor. It's like putting your little pinky on the scale. And the only reason this shows up in thermography is because it's an asymmetric pattern or one-sided pattern. And why that's so important is breast cancer always shows up asymmetrically. So if we see something develop, we want to keep an eye on it. Sometimes it's just the way a person looks. Sometimes people just have an asymmetric pattern, and if it's showing up the same way and it's not getting worse, then we know it's not breast cancer. So we're going to keep an eye on them. But then the TH4 and TH5 really go up with high criteria with a risk for malignancy. So these are the ones that we're a little more concerned about, and we're going to give them a lot more attention. And at some point they may need to get in for a mammogram or an ultrasound to take a look at those lumps. So here's the first this is a TH1. And if you look here on the side, you see this scale, and this is a color scale, and I picked this particular scale because it's as close to what your body looks like, and you can see the gold and the white is hot, and this blue and purple are cold. So this big dark stuff in here are cold fibroadenoma cysts, and they're totally benign. So when we have fibroadenomas, we put a TH1 and we put the F after it. That means there's a fibrous tissue in the breast. But these have a small amount of vascular features. Emission levels, or the amount of heat coming out, are pretty symmetric. Nothing to be concerned about at all. That's a healthy breast. Here's a TH2. Now you notice no F after it because she doesn't have the fibroadenoma. She's got normal vascular features, symmetric. That's like picture perfect little breast there. Okay. And then here's the first sign of an asymmetric or one-sided pattern. And you see this is her normal breast. And then this is the breast that something's developing in. Now, this could be breast cancer in the early stages, or it could be an infection. We don't know. So what we do with thermography is we put their hands on ice, and we do a set of 6 pictures before and after they've touched ice. And we're going to look through every one of those little spots, check the temperature before and after. I have a $6,000 diagnostic program that lets me go into each little spot. I showed that to you when you came in. Yeah. And then we can see if it's responding. So right here I'll show you. We looked at the temperatures before and after. So this is before and this is after. And each side contracted down exactly 0.5 degrees. Now, so that's showing me that it's more likely an infection rather than the neoangiogenesis. And the reason is neoangiogenesis, that's the new blood supply that develops around feeding a tumor, has nitrous oxide in it. And nitrous oxide is a vasodilator. So when you touch ice, everything contracts down. Where's that blood going to go? It's going to go right into the place with the vasodilator. So it'll flush in there and it'll actually get hotter after you touch the ice. So it's kind of a neat little tool that we have. So here's a TH4. She doesn't have an F there either, but she's got 2 features. This is what's put her up in this category. She's got a big vascular feature here, and she's got whole breast hyperthermia. And even though this is going up to a 65 to 85% risk of confirming malignancy, the difference between the 65 to 85 is whether it responded to temperature change. And on her, this didn't respond. So it brings it up into a higher category. However, when I see women with whole breast hyperthermia, and I have seen this a lot coming out of a mammogram, believe it or not, from smashing their breast. A whole breast hyperthermia is from mastitis, an infection from their poor little bosom being smashed.
Yeah, okay.
It's pretty traumatizing. So here's a TH5, and she does have an F here, so this is a little fibrous tissue in here.
Okay.
But this is her normal breast. And then this is the breast that has the neoangiogenesis in it. So, and you see it's 1.4 degrees hotter than the hottest point of the other side. This is called an anarch sign. So it's getting significantly hotter than the other side. And it's covering two quadrants, the cranial lateral and the caudal lateral. Here's a picture of all the different sides, so you can see a little bit more comparison. Complex vascular feature covering two quadrants, 2 points that are 1.4. So you were asking me earlier about where do I see the lump. We don't actually see a lump with thermography, but you see these two really hot spots. Pretty good chance that's where the tumor is. See, as all these blood is feeding it. So, and the nice thing about this is if you get that out before it goes into the lymph nodes, no chemo, no radiation, and we're just going to build their immune system up just like you did. I think the regular allopathic doctors like to radiate them, do radiation instead, but,
Yeah.
you know.
Let's avoid that.
Yeah, we want to radiation's enough. So here's a woman with DCIS, that's the abnormal cell growth behind the nipples, and you can see the difference. So we can see if you have some DCIS, we can see if it's gone outside the ducts and has a blood supply, or if it's in these early stages, you can work on it nutritionally and turn it around. And the nice thing about thermography is because you can see it, you can also see it when it turns around and gets better. So let's look at a few other things that you can see. Here's augmentation. See how cold those little implants are? And here's augmentation that this woman has 30-year-old implants and they're decomposing. And you can see that the side view is letting us see this blood supply behind the augmentation. So it does, like mammograms, it's hard to do a mammogram on a woman with an augmentation, and you can rupture their appliance. And so, but here it's decomposing, it's leaking into her lymph nodes. This is all inflamed lymph nodes. Here's her liver, totally toxic. And the same thing on this side. This one's decomposing also. So this woman's feeling very toxic, and through getting a written report, she can go into her doctor and say, I need these removed.
So for those women out there that have augmentations that are, especially the old ones, you know, please come in and get a thermography. That was an excellent way to see what's going on
and
in there.
it's no painful. There's no smashing or radiation. You just stand there in a room, cool room, and I'll take a left, right, and frontal views, and then we can take a look. And surprisingly enough, some of them are just fine.
Okay.
You know, there's not all of them are leaking or anything. These are other things thermography sees. This is a man's face, and this is his eyes, and we're seeing the level of stenosis of the carotid artery. That's how clogged up his carotid artery is, and predisposition to stroke. And so we can see if it's clogged up. And because I'm a holistic practitioner and I'm into prevention, I like to catch people really early and put them on protocols to reverse it. So most of the time that's from heavy metal toxicity. And so, you know, even something as simple as cilantro can help clean out heavy metals and mercury out of the body. But we do have oral chelation products that we can give people and help turn this around.
Okay.
Most of the doctors are not going to even treat you until you have a 75% reduction in blood flow, and by then they're doing surgical procedures. So we'd like to avoid that if not possible. So here's looking at somebody's thyroid gland. I don't really do this very often, but if somebody's been on Synthroid for a long time, we want to see if that organ's even functioning. So this is what we do for that. Here's looking at the spine for upper and lower spine for chiropractic, and we can see subluxations just like you could with an x-ray. And then this woman has lymphatic toxicity, and she's coming pretty consistently with this lymph being lit up. And so this next picture is her before and after. I finally talked her into doing my 21-day cleanse, which basically gets you off of white flour, white sugar. It's kind of an eliminatory diet, so it gets you off all the things you could possibly be allergic to.
Okay.
And obviously 21 days can do amazing things with your body. Can you see the difference? See all this little speckly stuff?
Big difference.
And then over here, it's almost all gone. So it really makes a big difference. Here's a little root canal infection. I just had clients come in and have full body scans in their jaws because they had all these infections in their mouth. Now this is something very interesting. Remember I said that to check the level of neoangiogenesis, we're going to put their hands on ice and check them before and after. This particular person it should be getting cold, and then you got a paradoxical response. Everything got hotter after she touched ice. Now that shouldn't happen, and why that happens is she's so stressed out when she touched ice, her body gave her a mini fever. So I say the paradoxical response to the autonomic challenge indicates an altered metabolic process of the sympathetic nervous system, typical of adrenal exhaustion. And I put that right in the reports because if we're trying to keep a patient healthy, this is the first sign that their immune system is compromised. So we're working on getting their immune system stronger. So let's see. Here's another picture, and this helps too to know her emission levels, the amount of heat coming out of her body is super cold. And that's a sign her thyroid's not functioning. She should be up here in the 34.8, 34.5, and she's all the way down 32.8. And so when I told this patient, I don't think your thyroid's working well, and she said, I don't have a thyroid. She had thyroid cancer, and they had taken it out. So that to me showed me, when I see low emission levels, I just put a little line in there, you should get your thyroid tested. So that comes in the regular breast thermography. I do that right in there. And then here's a woman with excessive vascularity bilaterally. She looks like she's pregnant, but she's postmenopausal. So that usually indicates her progesterone levels have dropped, because progest is for gestation, and when you go through menopause, you don't need it anymore. So that drops down, and then it makes your estrogen levels look too high.
Okay.
So how I'd help her get balanced out is give her a product like calcium D-glucarate, which boosts up her liver function and helps calm down that extra estrogen. And then all of a sudden she comes back and looks normal. And
Great.
feels normal too. It's a pretty emotional state to be in when you're high estrogen. This is a woman who was on bioidentical hormones, but she didn't need them. And it kind of made her look clogged up. Her lymph wasn't able to, and her liver wasn't able to clean that stuff out fast enough. So she went off of them and came back and looked more normal. And this is kind of subtle, so it might not be easy for a layperson to look at and see the difference. The next picture is a person who had ductal carcinoma. She went on, I asked her to please take it out, because do a surgical procedure to remove it, because it had such a huge blood supply.
Yeah.
But she refused to do that. She went on my protocol, and 17 months later, it's completely gone. So I'm kind of glad she didn't in some ways, because I got a chance to see my protocol really works.
Yeah.
Most people, when they have an abnormal thing going on in their breast like that, 3 to 6 months it's gone. But for her, it took that long because she'd been on synthetic hormones for 26 years. 16 years of birth control pills and 10 years of postmenopausal hormone replacement therapy. So it's really important to not take too much hormones. This is a woman who's been breastfeeding the same baby, and only the left breast works, because you can see. And it's hard to know whether it's because it has a better blood supply. Sometimes babies like to nurse on a breast because the milk comes out faster through the nipple.
Okay.
So they get attached to the one that just give me the food. Get down to business.
Yeah.
You know. Here's another woman who's breastfeeding. So see how highly vascularized the breasts become when they have that blood supply. Now that you've looked at the other ones, normal breasts, you can see. And then this is a rare case of pseudoangiomatous stramina hyperplasia. It's a benign condition, 72 cases ever found in the United States. And it has all the signs of breast cancer. And so sometimes the doctors say, well, thermography sees things that look like breast cancer, but they're benign. But honestly, the breast is totally deformed. It has an edge sign here, whole breast hyperthermia, and the mammogram and the breast surgeon said it was breast cancer too. So it wasn't just the thermography that was fooled by this one. But I asked the patient afterwards, are you upset that I told you to take that out? She goes, no, it was painful and it was deforming my breast, and I was really glad to get rid of it anyway, even if it was a benign condition. So, and then this is just, you know, we're looking at heat, so this is thrombophlebitis, and basically what it is an inflammation of the vascular system. It will be like varicose veins. You could probably see them on the surface, but you can just see how you can see things with thermography. So, that's it for my presentation. I hope you enjoyed it, and if you're interested in getting a thermography, you can call our toll-free number, 866-766-2468. Thank you.
And how about your website?
Oh, optimanhealthclinic.info.
All right. And if there's any practitioners out there that want to offer this in their clinic, you are available to help get them set up in this area, of course.
And I'd be more than happy anywhere. I've actually gone out of state to set people up in clinics. But I also come and teach a free class on preventing breast cancer. So I'm teaching your clients how to take better care of themselves, and I have a beautiful video on how to do breast exams that I include in that.
Excellent. Thank you very much.
You're welcome.
So can you show us the camera that you use to actually do the thermography?
Sure. This is a FLIR. It's a $35,000 far infrared camera.
Wow.
They're actually used for military.
Okay.
They put them on the tanks and can see military action at nighttime. So it wasn't for our little bosom they developed this.
Okay. Secondary discovery there.
Yeah, and I think that the reason that they're so expensive is that they're so small. The other cameras that I had was huge, and it took liquid nitrogen. These self-cool, so this is a little bit more extensive, and the resolution is unbelievable on it. I mean, just fine, detailed resolution.
So the patient will just stand over here, and you'll just point the
Yeah, they
the
just
camera
stand bare-breasted in the room for 5 minutes because their clothes have held their heat in, so they need to cool off.
Okay.
And then I take their pictures, and this is what the images come out. This is a $6,000 diagnostic program. So over here you see the temperature gauge. So this is cold, and this is hot. And I take a lot of pictures because sometimes there's little spots that you don't see in the other pictures. But for our purposes, I'm going to cut it down to just 3 pictures so that you can see the detail of this diagnostic tool. But so I can go in and within 1/10 of a degree tell what temperature each spot is on her breasts. And what we're looking for is symmetric features. So we want to see that she has the same amount of features, the same type of features, and the same amount of heat on each side. And so that's basically how I do that. And anytime something shows up asymmetric, then we look at how hot is it compared to the other side, how many quadrants does it cover, is it vascular-like or a diffuse pattern. And see, these little diffuse patterns that we're looking at here, those are lymph nodes.
Okay.
So they're not as concerning to me as a vascular-like pattern. So there's a lot of detail in thermography, and not all the practitioners that are out there doing reports really know what they're looking at. Some of them are kind of new on board, and they give these simple little reports with one line. You have a TH3 in one breast and a TH2 in the other. And it doesn't really tell you what's going on, whereas my reports I go into detail and say it looks most likely to be a personal variant, meaning that's just the way you look. Or you look like you got a little infection going on in that breast. Now, infections should get better if you put them on a protocol, but if it's breast cancer, nothing you do is going to make a difference. It's going to get worse. So if they come back in 3 months and it's worse, then we're going to get them in for a procedure. So.
Okay.